everybody, my name is Hassan Nafid. I am an anatomy and physiology instructor at Madison College in Wisconsin. I will continue talking about our anatomy and physiology series. This time I'm going to talk about one of the bones of the appendicular skeleton. I'm going to talk about the pelvis or the bony pelvis. The pelvis is a bone that is formed of three pieces that are fused together. Actually, they are continuous as one piece. The pelvis, actually the two bones of the pelvis form a room that lodges and protects the organs of the reproductive system as well as parts of the organs of the urinary system. If we take a look at the pelvic bone that I have here, I want to show you the parts of the pelvic bone that we could identify together. Here is our pelvis, one side of the pelvic bones. It is important to recognize and find out what side are you dealing with of your pelvis. We know we have two sides. We have a right side and a left side. Usually you look for that rough surface which forms the articulation of the sacroiliac joint. It is this part of the bone. This is usually the posterior part of the pelvis. Also, another landmark is the acetabulum. The acetabulum is that half cavity or half circle depression that lodges the head of the femur. This is usually points or face laterally. So with that facing laterally, acetabulum facing laterally, and the sacroiliac joint in the posterior side, this would tell you this is going to be our left pelvis. This is the ilium. The top part of the bone is known as the ilium. This is our ischium here, while this is known as the pubis bone. So they are continuous if you notice, and it is one piece of bone that has three parts or three bones that are continuous with each other. If I turn it this way, take a look at it from all sides. So, taking a look at the pelvis and holding it in the right position, this is known as the iliac crest. And the anterior part here, this is known as the anterior superior iliac spine, while the lower one is known as the anterior inferior iliac spine. So we have anterior superior iliac spine, anterior inferior iliac spine. If you go on the back here, you will identify our superior posterior iliac spine. It is easy to see when you put it in the lateral position or faces this way, so you can see the spines. This is a posterior inferior iliac spine. This is the greater sciatic notch. You go down right there, you will find the ischial spine. You turn it this way, you will identify our acetabulum. And we said this is the part that fits or lodges the head of the femur. Right? If you look at it here in the back, this is known as the lesser sciatic notch, while this is the greater sciatic notch. So greater sciatic notch and lesser sciatic notch. In between is the ischial spine. This is the obturator foramina. This is our obturator foramina. So, the pelvis, as I said, is part of the appendicular skeleton. It articulates on the side, the two sides, posteriorly with the sacrum and forms the sacroiliac ligament. And anteriorly, the two pelvic bones articulate to form the symphysis pubis. Thank you for watching this video, and I'll talk to you another time about one of the bones of the skeletal system. Thank you.